Melina, we are grateful for your time and super glad you could join us to share your expertise on a topic that is so prominent in the cancer community, particularly the young adult cancer community. The YAC Prime study that we partnered with Dr. Sheila Garland found, I believe, 86% of young adults in our study had significant symptoms of fear of recurrence. And so it's a super prominent thing in our lives collectively. And we're really glad to spend some time with you to hear your perspective on it and to work through some of this challenge with you today. So I'm handing the mic over to you, and the floor is yours.
Thank you so much, Jeff, for the introduction. And it's such a pleasure to be with you guys here today and talk more about this really important topic. As you mentioned, this is a huge need that I see a lot as well when I'm seeing clients, how to work through the fear of not knowing what the future holds, and the fear of the cancer coming back or progressing. So I'm going to start by sharing my slides. I'm going to jump into things. So the first off, the goal, what I really hope, the reason I'm here, and what I really hope you'll gain from this workshop is to talk about this really important topic and to understand a little bit more about fear of cancer recurrence. What is fear of cancer recurrence? I mean, I think we all have a good sense of it's anxiety of, is this cancer going to come back? And, I've learned so much. I've worked at the Ottawa Regional Cancer Foundation for the last 9 years, as I'm a social worker by background. I work as a cancer coach. So I'm trained in health coaching, in addition to my social work background. And I've learned so much from my clients too about, even though I've not gone through cancer myself, I've learned so much about living with anxiety and, what the impact that can have on people's lives day to day. And what I hope you'll gain from this workshop is a little bit more information on, fear of recurrence, on what are some of the signs that the fear of recurrence is maybe getting to a level that you might need some more support, and really jumping into strategies and what can you do to help yourself when you're coping with that fear. And I think you'll notice through the workshop that my goal, as it is with anyone I'm working with as a cancer coach, is not to come in and tell you guys here's what you should do, because you're really, yourself best and you're the expert of yourself, but rather to explore with you and to do a bit of an interactive workshop where we're brainstorming ideas together on things that help you when you're coping, when the anxiety is really bad. What do you do to get yourself back up? What do you do to, maybe it's to distract yourself, maybe it's to challenge your thoughts somehow, maybe it's to come back to this moment. But I hope you'll gain a chance to really explore that through this workshop, the strengths that you have and the things that help you. And of course, I'll also be providing some additional tips for you on things that you can do and some evidence-based strategies for managing anxiety. But I hope that we can really spark together an interesting conversation on this topic and brainstorm some ideas that really feel that they could resonate with you. I'll also be talking a little bit on what the heck is a cancer coach, because you may be wondering that as well. So I'll get more into what a cancer coach is and how you can access our program if you feel that could be helpful to you. So let's jump there. Let's start at that point, because it may be kind of a good place to start before we jump into really the topic of today. So the Ottawa Regional Cancer Foundation, we've been around since 1995. We originally started as a fundraising organization. At the time, we were the Ottawa Regional Cancer Center Foundation, and our offices were right within the Cancer Center at the Ottawa Hospital General Campus. And at the time, we raised money to help, fund clinical trials and research. After a couple of years, though, the organization became a community organization. So it left kind of the hospital and started, the groundwork really in the community. And in 2008, we did a massive survey to people living within the Eastern Ontario community. And we asked people, what did you need when you were going through cancer? What wasn't there that you needed? What was missing, right? And we were trying to understand how we as an organization could try to find what are the gaps in the system, and how what could help. So from that, people were telling us, I'm sure for many of you this won't be a surprise, but they were telling us, I need more time with a healthcare professional. On average, you get about 15 minutes with an oncologist, and that's very little time for when your life has just been thrown upside down and you find out you have cancer and you have all these different questions that are going through your mind. And what about work, what about fertility, what about how do I make sense of this? I'm overwhelmed, I'm shocked. What about, I'm hearing people talk about immunotherapy, what's that? So people said, I need more time with a healthcare professional. And the hospital does a great job at taking care of the tumor. But a lot of people found after treatment, they were left with a lot of fatigue and exhaustion, what we call cancer-related fatigue, and cancer-related brain fog, so difficulty with memory and multitasking. And people talked about, like, my concentration's not what it used to be, and like I'm really worried about going back to work because I can't focus, or I can't remember things. And so from all that, came the development of an individual program where people going through cancer were able to be matched with a healthcare professional. So either a nurse or a social worker who had additional training in health coaching and really focused with people on the things that matter most to them. So people can access about 4 to 8 hours with one of our cancer coaches, and we work with you. In Ottawa, that's face-to-face typically. If it wasn't for, COVID-19, that's kind of stopping us from offering the face-to-face right now, but we also offer it by telephone and video chat. And it's available to people, mostly people that access our services are in Eastern Ontario and Western Quebec, but it is accessible to people, other places in Canada as well. So if you are, seeking some more support and wanting to connect with a coach, we are here to help. So you might be wondering, what are some of the things that we help with? And these are just some examples to give you a bit of an idea. So we sit down with people, either, actually face-to-face sit down, or sit down with you while you're on the phone, or through video chat, and we start with what's happening for you right now. What are you finding most difficult? What would you most like to focus our sessions on? And these are some of the top needs that come up that people bring up. So managing stress and emotions, and working through grief and loss, because when you're faced with cancer and you're going through this, there's a lot of losses and there's a lot of grief. And grief isn't just something that people experience if a loved one dies. Grief is the loss of how life used to be, the loss of all the secondary losses that come with cancer, the loss of going to work and feeling like you're living your life, the loss of being able to do the type of exercise you used to do, the loss of for some people, let's say they have breast cancer, the loss of their breasts from surgery. So there's a lot of different losses. And managing anxiety and fear of cancer recurrence, that's always been a really top reason why people come for coaching, is how do I live? How do I continue living after cancer? Not knowing when's the other shoe going to drop. Is the other shoe going to drop? Because it might not, but how do I live with that? And, those constant thoughts about, will the cancer come back? Some of the other reasons people come for coaching are things like figuring out what now. A lot of people talk about after cancer feeling that, who am I now? Like, what are my values? What are my priorities? Having just gone through a big life event, a lot of people might look at the work that they're doing, their job. Is that what I really want to be doing, right? Some people might go through a career change, or some people might look at their work-life balance and think like, maybe I want better balance. Maybe I want more time doing the things that really are meaningful and matter to me. And try to figure out life after treatment, coping with side effects. So that brings me to managing side effects like cancer-related fatigue and brain fog, side effects that can sometimes continue for a while after treatment. And of course, we're there to help people while they're in treatment as well. So, we often work with people and have conversations, and maybe I'm working with someone and their goal is I want to manage my chronic pain. So we look at, what are you doing now? What helps? What else could you do? And we brainstorm ideas together and we come up with a plan so that they feel that they can really take action. Coaches really, we get down to really specific with people. Okay, you're going to start doing this. When are you going to start? And how are you going to do that? And what's going to get in the way? What do you think you can do to overcome that? And then we check in with you, and we're there to support you along the way. We also work with people who may be newly diagnosed and who, for example, might want to prepare questions for their first appointment with an oncologist, or maybe they have to make decisions, whether it be early on when they're first diagnosed, or through treatment, or when they're done treatment. Big decisions like do I want to get this treatment or not, or I have to pick between these two treatments, or am I ready to go back to work? So trying to make these hard decisions. We also are there to help people communicate with their healthcare team, their family, their kids. As Jeff mentioned, I run a couple groups outside of the individual coaching that I do. And one of them is for school age kids who have a parent living with cancer. So I end up working with a lot of young adults who have young kids, whether they be school age or maybe they're even littler, and they're wondering, how do I tell my kids about my diagnosis, or how do I tell my kids that the cancer spread, or whatever that might be, and how do I support my kids through that? So coaching is there to help with that too. Return to work is a big need for many of our clients, especially young adults, right? So getting back to work after cancer, how, what to know about that process and what to expect, and trying to make the most successful return back to work. Yeah, so I was just saying that we coach people at any point. So whether they're newly diagnosed or they're in treatment, maybe they're post-treatment dealing with a recurrence or metastatic cancer, or they're at end of life. And we also coach caregivers. So we're there for your spouses. We're there for, your parents. We're there for anyone in your life that is wondering how to best support you and be there for you. We're there to coach and support them through that as well. And sometimes those meaningful projects might be, I want to get back into, I want to live healthy, like I want to exercise more, eat better. And so maybe those are the meaningful projects. Maybe someone is living with a cancer that's palliative, and maybe those meaningful projects are how you want to spend the time you have left. So as coaches, we're there to really focus on whatever you want to focus on and help you create a plan where we are not the experts. You are the expert. And our role as coaches is to ask you powerful questions and help you with creating an action plan that feels right to you on how you're going to get from where you are to where you want to be. So I think a lot of these things, I'm just trying to move ahead on my slides. It looks like it's frozen. Let me just try another way. Oh, there we go. So I think a lot of these things I've mentioned, so I'll skip over this part here. So yeah, cancer coaching is where we partner you with a licensed healthcare professional who acts as a coach. And as I hope you can hear me as I'm trying to kind of say that we focus on the person, not the cancer, on how cancer impacts you in your life. And so working together with you, we help you come up with a personalized plan on what you'll do to help yourself and meet the goals that are important to you. And through coaching, our hope is that you develop the knowledge, skills, and confidence to feel more in control and to help you move forward and to live in spite of cancer. And so we ask you powerful questions to help you get from where you are to where you want to be. And this is all available at no cost to you. So, so I hope that information is helpful to you. And this is just a quick overview of some of our other services. So individual coaching, as I mentioned, it's work in partnership with a coach over time to help you work towards goals that matter to you. Our Rebalancing Life After Cancer program is a 4-week virtual workshop series that is all about helping you figure out how to go back to work. We offer brain fog programs, so an 8-week virtual course on managing cancer-related brain fog. The CLIMB program is a program for school-age kids who have a parent living with cancer. And we also offer Reiki, which is an individual practice of energy work. So similar to massage, but a little bit different. A Reiki practitioner puts their hands just above your body, and what they're doing is they're trying to improve the flow of energy in your body, and to channel their energy to your body to help with how you're feeling. So let's jump into the real reason you're here and the topic of today, which is fear of recurrence. So, fear of cancer recurrence is the fear, worry, or concern relating to the possibility that the cancer will come back or progress. And what's interesting too is if you look at the research, you would think maybe that the higher your chances of your cancer coming back, that the higher your fear, but that's actually not true. A lot of the research shows that it doesn't really matter what the chances are of your cancer coming back. Some people can have a cancer that your chances of it coming back are very, very slim, but you can live with a huge amount of fear still of that happening. And other people may worry less about the cancer coming back, and their chances of recurrence are really high. So it's not so much about the higher the chance of it coming back, the higher the fear. Every person is different, and how people cope with the anxiety that they feel and what they experience and how much anxiety they experience is different. So, as Jeff mentioned, it's one of the most common psychosocial needs expressed by young adults living with cancer. So, in the PRIME study that YAC did, it is one of the very common needs. It's also, if you look at a lot of reports through the Canadian Partnership Against Cancer, Cancer Care Ontario, and different research studies that have been done on fear of cancer recurrence, they all reveal that a huge amount of people who've gone through cancer experience a lot of fear of recurrence, and the young adult population especially. Fear of cancer recurrence, it's a normal reaction, and it makes sense if you think about it, that because you're not getting scans regularly, it is normal that you're wondering, what is happening inside my body? And is this coming back? A lot of the times, people, while they're in treatment, will feel like, there's a lot of fear and there's a lot of anxiety and stuff for sure when someone's going through that. But there's also, you're getting those tests. And so you're getting results regularly, and you're meeting with the doctor, and you've got that support. A lot of people express that after they can feel like, and I had a client who explained it so well, that felt like he was on a bus while he was going through treatment. Then he was on a bus with the supportive team that was here for him. And when he finished treatment, it kind of felt like for him that he got thrown off the bus in the middle of nowhere. That, after treatment, it was, where do I go from here? And trying to figure out the new normal in life now. And because you're not getting those scans all the time, they're spaced out in between, you're getting, screening and things like that, but it's not always, as often as it was during treatment. There's more, fear for people. So fear of recurrence is a normal thing that a lot of people experience, but it can impact your life in negative ways. And so it is good to try to find ways to manage it and to cope with that fear. It's, and we talked about this, it's no better or worse because the actual likelihood of the cancer coming back, some people can have that very low chance of recurrence, but live with a lot of fear. So, there's a normal amount of fear, but there's also what they call, like a type of fear that is extremely high and worrisome, a fear of recurrence. So we'll talk about what are some signs that maybe the fear is extremely high and impacting your life in a way that maybe you need some more support than just a couple strategies. Maybe you're needing some more professional support. So we'll get to that in a moment. So how can fear of recurrence impact your life? These are some of the things that the research tells us and things that we hear from clients. I'll go through kind of a couple of these, and I do welcome you as well to jump in and to be part of the conversation. So if you have other ways besides these that it's impacting your life that you'd like to talk about, please, unmute your mic, write in the chat box. And, I open up that question to anyone. How does living with the fear of recurrence, how does that impact you in your everyday life? So here are some of the ways that we know about. So people can live with a lot of sadness and grief, anger, numbness, isolation, or a loss of confidence in themselves. So living with that fear can have an impact on you emotionally. A lot of people find they have hypervigilance before procedures, appointments, anniversaries. So a lot of kind of checking, like that body checking, where you might be, is everything okay? Is there anything here? And just being, very nervous before those appointments, which completely makes sense. Sometimes though, that can lead to, people feeling that fear is so high that they're checking their body all the time, and it's maybe getting to be, too much of a part of their life. So it's normal to check and it's good to check and to be aware, but is it impacting your life, and is it causing you a lot of anxiety that you're checking, many times a day? For some people, it can lead to depression, and withdrawing from your usual activities, maybe sleeping more, not eating as well. So it can have an impact on your life that way. A sense of hopelessness or feeling paralyzed and feeling that you can't move forward and you can't, it's where you might kind of stop planning things. What's the point? So you might not plan, something in 6 months from now because you're thinking I might not be here. And so if your head's starting to think like that, but there isn't any reason, right? Your doctors haven't said, you're living with an advanced cancer and you may not be here in 6 months. If there's no medical reason for it and it's really stopping you from living and planning, those might be signs that, you might need some more support.
Melina, just
Yeah,
to jump in, there's a lot of great comments in the chat.
good.
I just wanted to share a few with you,
Please.
like, people feeling useless
Yeah.
and saying hi, Denise. Denise is saying hi to you.
Hi, Denise.
But the plans for the future is there a bunch of times, challenges with school or
Yeah.
moving forward, and making plans for the future. I think someone else mentioned just, not really having scans that give them certainty about the state of their cancer. So it just creates another heightened level of recurrence because they're never sure if they're actually even in the clear, so to speak.
Okay. Yeah.
There's a lot of stuff going on in there. I can't read as quick as you guys have little tiny things down there, but I just wanted to share a little bit of that because there is lots of those comments in the chats about some of the bullets that you've got here on the screen and other things you're speaking to.
Perfect. Thank you so much, Jeff, and thank you everyone for sharing those things. And please continue to share. It's really, this is meant to be really a conversation. So I'm throwing out some slides, but I'm going to jump into even more questions as we go along because I feel that that's really, there's a lot of impact in just having conversation, talking about this. So thank you. Yeah, those make sense for sure. And I find, I work with clients too that like sometimes they'll get their scans and it's, not clear, and they're never told you're cancer free. They're never told, certain things. And it's, well, what does that mean? Or, it can be hard to cope with that for sure. And that can lead to more fear. Some people have trouble sleeping, trouble concentrating, panic, anxiety can impact your relationships. And sometimes people talk about whether it be their spouse or their boyfriend or girlfriend or their parents or their family, they talk about how they don't get it, that, they're talking, maybe your family, about how, cancer's over and everything's back to normal, but you're thinking, no, like this isn't over. I'm still coping with all these side effects, and you're living with the fear of it coming back. And other people may be saying, oh, don't think about that, but they're not really getting what that's like for you to be living with this. And that not knowing and being worried. And of course can impact school, as someone brought up, impact work, decisions you make or don't make. And there's things that can make it worse. So, negativity bias. So by that, what we mean is, we often hear negative news, and we hear, you might hear that a friend of yours, their cancer came back. So you might think, is that going to be me? Is that going to happen to me? Right? Or someone close to you dies from cancer. And that comes with all types of different things, like survivor's guilt, feeling really bad that it's happened to them, and thinking about, feeling bad that it didn't, not that you want it to happen to you, but that, feeling really bad for them, that's what happened. But also a lot of fear that for you, that will that happen to me? And it's hard too if you're, before being diagnosed, if your story and your experience with the word cancer is people having died from that, or having really horrible treatment experiences, then that's often your frame of reference. So when you hear cancer, you may be, everyone is terrified, of course, when they go through that and they hear that. But for you, you might equal that with something different. I remember a couple of years ago, I was working with a client who had moved from another country, and for her, when you were diagnosed with cancer where she was from, it automatically, typically in her country, meant it was a death sentence, because it was often not found at an early stage. It often was, if you're diagnosed with cancer, it's found at a stage 4. So I remember her, very clearly explaining that when the doctor came out and told her it was cancer, she was describing this to me, and she said, I knew I was going to die. And we were talking about that. And she was actually there because she had her pathology report. So she had the reports from the doctor, and she wanted to better understand her cancer. And we looked at it, and she had a stage 1 cancer. But for her, when she heard cancer, she thought about where she was from. And she automatically, if you had cancer, that's what it meant in her country. But that wasn't what was happening. And so sometimes we might hold thoughts about what's happening that may be different than what's actually happening. PTSD is an important thing to talk about too. So post-traumatic stress syndrome, there was a wonderful article a couple years ago that was published where they talked about, when you go through cancer, your chances of being diagnosed with PTSD are typically 1 in 4. That's what the recent studies have shown. And, although it is normal to have experiences where sometimes you go to the hospital and you're like, oh, you might have some memories, PTSD is different. So some people, again, 1 in 4 who've gone through cancer can experience PTSD and are diagnosed. But yeah, PTSD is another important thing to talk about when it comes to the emotional impact of going through cancer. So, what that looks like is, avoidance behavior. So maybe you're driving another way because you don't want to drive by the hospital, which we might do. But, if you're doing that all the time and you're going out of your way to really avoid driving by it, if you're having a lot of severe flashbacks when you're going back in the hospital, if it's causing you to have a panic attack, if you're, having a lot of dreams about it, and, it's good if you're concerned in any way that you could have PTSD, good to talk to your doctor about it, or to connect with a counselor or therapist to bring it up. But it's a very real thing that does impact people post-treatment and during, and yeah, and it gets better with the proper support and treatment. And the last thing I was going to mention is that for some people, living with fear of recurrence can sometimes be the thing that helps them shift their priorities, live more in the moment, not sweat the small stuff. So there can be some positives, but oftentimes it can have a very difficult impact on people's lives. So, and when it really gets worrisome, as I mentioned, the problem is when it's always on your mind. It's impacting your quality of life. You're finding that you're not planning things for the future. You're not living anymore, and you're feeling really, really stuck. And so some key features of what they call clinically significant fear of cancer recurrence is high levels of preoccupation or worry that is persistent, that will not go away, that is always on your mind. That hypervigilance, that checking all the time for symptoms, that jumping to that conclusion automatically that if you have, one small thing, that it is cancer, which again, it's hard to sometimes know the difference, because that is normal to think about, could this be cancer, right? And it's good to get it checked out, but is it worrying you so much that you're panicking, and that this is often happening, that you're finding things on your body, or that you're checking consistently? And functional impairment. So excessive body checking, avoiding your medical appointments, excessively seeking reassurance, like going to the doctor often because you're worried about things, or if your functioning is impacted in the sense that, you're not getting up to go to school, you're not eating well, you're not being able to take care of your kids, you're not functioning that way. Those are all signs that connecting with a counselor or a therapist, or speaking to your family doctor, may be some really good steps if it's impacting you to that degree. So what I'd like to do with you guys is take a moment to do a little bit of a reflective activity, a reflective exercise, and then kind of jump into a discussion about some of the things that can help people cope with that fear of the cancer coming back. So I'm going to invite you to grab pen and paper if you have it handy. And just get it ready, have it near you. Don't use it right away. Just kind of put it on the table and leave it there for a moment. And I'm going to invite you, if you're comfortable, to close your eyes and to start by taking just a couple deep breaths. So breathing in through your nose and breathing out through your mouth. Breathing in through your nose. Breathing out through your mouth. And I just invite you to breathe. To not think about anything else right now. Thoughts will come and go. Just keep grounding yourself by coming back to your breathing. Breathing in through your nose. Breathing out through your mouth. And I invite you to imagine that you're jumping on a train. There's a train coming at the station and you just jump on. You don't too much know where you're going, but you've jumped on a train. And the train just keeps going and going. And as it keeps going through tunnels, and it keeps going through dark places, you start to realize that this isn't a train you want to be on. And you start to realize that you want to get off this train. Because what you've actually jumped on is the train of anxiety. So the big question is, how are you going to get off your train? Because once you have one thought, you have another. Maybe the first thought was, I wonder what this is here on my body. Maybe the next one is, I bet the cancer's back. Maybe the following one is, I bet this time there won't be any more treatments for me. As you imagine those thoughts, you're going further and further down that path where you don't want to go. I want you to imagine that you ring the bell and you ask to get off at the next station. And you get off. And then another train comes along. And you jump on this train going back to where you were before. And while you're on this train, what you're seeing ahead is good. What you're seeing ahead feels like your life. Feels like the grass as you see it, the sky as you see it. The big question is, how are you able to get on the good train? What brought you back? What brought you back to this moment? I invite you to take a couple more deep breaths. Breathing in through your nose. Breathing out through your mouth. Breathing in through your nose. And breathing out through your mouth. And when you're ready, I invite you to slowly bring your awareness back to the room. Start to feel yourself sitting on the seat. When you're ready, start to open your eyes and come back to this moment. We're not always aware, but we often jump on trains. We often have scary thoughts. And when that starts, we may have more thoughts. And we might find ourselves in this cycle of anxiety and worry. And although we can't stop those thoughts from coming up, they come up. It's natural, it's normal to have anxiety. We can decide, how are you going to respond to those thoughts? What are you going to do to help yourself when that pops up? When you are being called to jump on the train of anxiety. So I'm going to give you a moment, and I invite you to just take your pen and paper and to think about and to write down, what are some of the things that you have the power to do to bring yourself back, to stop the anxious train. When you're trying to get off the train, what brings you back? Maybe it's something that distracts you. Maybe you do something for yourself that brings you back, that keeps your mind off things. Maybe you decide not to listen to the thoughts. Maybe you tell that thought, thanks, mind, but you try not to jump on the train. I invite you to just take a moment and just write down anything that goes through your head. What are things that you currently do or new things you think you can do when those anxious thoughts pop up to help yourself? So I'll just invite everyone to maybe journal that, write about that for like a minute. And then I invite you to jump in after.
Go through 3 things I've done well that day. Gratitude journal.
Yeah.
Excellent suggestions there.
Definitely. Those are great ideas for sure.
Photos that make you happy, loved ones, pets. Excellent.
Yeah.
Love it.
That's great. Those are great ideas. And you'll notice when I jump into some of the strategies, I have a whole part about gratitude and coming back to, the things what are the things that are good? What are the things that help? And, when we do that, it's not about ignoring what's not good. It's about kind of balancing things, like coming back to, when you think about those things, and as you do a gratitude practice, over time, what tends to happen for people is that they become more optimistic, or they become able to see the good more easily if they do that, on a regular basis of finding the good things. And I love what was just read about 3 things I did today that were good too, like finding what are your strengths, what are the good things you're doing, right?
I don't know if you're going to go here, Melina, but perhaps. But I think it's great to hear people talk about, sometimes there's, strategies or practices you have that are in the immediate moment to help you.
Yeah.
And then other times, like you're talking about with gratitude, it's things that are more proactive, that you're trying to maintain your space where you're centered and you feel great. And I think it's awesome for us all to have both sets of tools in the toolbox, because we can certainly use them.
Definitely, for sure. Yeah, you bring up a good point, Jeff, that there are some techniques that it takes time and you practice them on a regular basis, and long term you see an effect. And then there are also, sometimes we all need kind of those strategies that, I'm having a panic attack, what do I do in this moment, right, to help myself? And so there are those strategies. And someone else said this to me recently, and it was really interesting, that it's also about, trying to sometimes notice, how far along are you? Like, if your anxiety was on a scale of 0 to 10, where are you right now? Because if you're at maybe a 3 or a 4 or a 5, you can kind of see, oh, it's getting up there, right? So maybe introducing some strategies at that time are good. Sometimes we only kind of notice when we're at a 9 or a 10, and we feel like, it's now I'm really in crisis. But if you can introduce those strategies when you're doing fairly well, or it's starting to creep up, those might be good times to do it. Like I often talk about kind of green light, yellow light, red light. So if you can introduce things at yellow light when you're, kind of midpoint, those are signs. And what are the signs in your body, right? Like check in with yourself. How do you know when you're anxious? What happens? For me, I feel anxiety, I feel nauseous when I'm anxious. I can start to feel nauseous, right? So what are your physical signs? And what are the thoughts? How do you know in your head that the anxiety is starting? The more aware you are of it, the earlier you might be able to introduce strategies. Sure. And I love all the different ideas. Like physical activity is great. It's one of the things. Sometimes people feel that one of the things that can help them with fear of recurrence is focusing on what they can control to prevent recurrence. So being physically active is, a great way to take action towards doing what you can, what's within your control to contribute to helping to prevent recurrence. And it's also, someone was telling me recently that when you're physically active, it can give you a lot of the serotonin and a lot of the things that you get from anti-anxiety medication and antidepressants. So not to say to stop taking those if you're taking them, but just to say that it actually has that much of an impact that it gives your brain all this serotonin and all these feel good kind of feelings. So that's great. Yeah. And I love what you said about, dancing and all the having something that you're doing with your hands, right? And you're focusing on something, so you're taking away from those thoughts and you're focusing on that action, right? So those are great ideas. Thank you everyone for all those ideas. So everyone's different with what helps them cope, right? And that's one that a lot of people do, where they will look at, is this a realistic thought? Like, do I have proof that this is true? Is it something I should take action on? And coming up with a plan is really good. Maybe it is something to get checked out, right? So it is good to come up with, what am I going to do about this, right? And that's a way of having control too, of like, this is coming up, and tuning in with yourself and not ignoring that, and seeing, what are we going to do? I often have clients too, like that will, kind of journal to get those thoughts off. Like they'll go to bed and they have trouble sleeping because their mind is going like the hamster, like you talked about, right? And so sometimes just writing it down, getting it all out and saying, here's what I'm going to do tomorrow about this, is a way of kind of getting, okay, I've got that. Now it's time to go to bed. But, sometimes our mind is going and we're thinking about those things because we're like, our mind says, you can't forget this. So if you write it down, you got a plan, that's for tomorrow. Now I need sleep. And yeah. Perfect. Thank you guys. You've brought so many great, unique ideas. So I'm going to jump into a couple other strategies, and a lot, some of them you guys have already mentioned, so I won't spend too much time there, but I'll try to focus on some of the other ones. A little bit of what Grace brought up was a little bit about kind of challenging those thoughts and reframing them. So sometimes maybe it is a thought that you really should listen to and get something checked, but sometimes it might not be, or it might be that your thought is jumping, from maybe this is something to the cancer is definitely back. And you might not have proof of that it's definitely back, right? So how do you take that thought, which is very powerful? If you think, the cancer is definitely back. If you imagine the anxiety in your body when you're thinking that, I would imagine that be quite high, because that's a very scary thought. So how do you take away, how do you kind of bring that thought back down a bit? So reframing your thoughts are a lot of what they call CBT, cognitive behavioral therapy techniques. And that's where, first off, you identify your thought patterns. What happens when I have a symptom in my body? What do I think? What happens? And even some people might find it helpful to write that down. So when they have one of those scary thoughts, like, what was the trigger? What happened? I noticed this lump on my body. That was what happened. That was the trigger, right? And what was the thought that went through your mind? And let's say in this instance, it was, the cancer is definitely back. Okay, let's challenge that. What proof do you have that this thought is 100% true. And 100% true is like the key part to remember. And then what proof do you have that this thought is probably not 100% true? And if you think about it, the chances that the thought that my cancer is definitely back is 100% true is very unlikely, because there isn't any proof that it is definitely back. So what could you say to yourself instead, right? So it's, you take the thought, what proof do I have that this is 100% true? What proof do I have that it's not 100% true? And what am I going to say to myself instead? How am I going to respond to this thought? How am I going to change it into healthier thinking? Maybe not overly positive thinking, maybe not saying the cancer is definitely not back, because if you say that, then maybe you won't get it checked out. And you should probably get it checked out if it is something that's worrisome. So maybe you shift that a little bit and you say, you know what, I don't know if the cancer is back or not, but I'm going to go talk to my doctor. I'm going to make an appointment, but I'm not going to jump to the conclusion that it's back because I don't know that yet. Or maybe it's, you know what, I don't know what's happening right now, but I'm going to focus on right now in this moment. So there's lots of different ways to do that, but CBT techniques, cognitive behavioral therapy techniques, are worth checking out if you haven't already. When it comes to managing anxiety, CBT is one of the evidence-based strategies that's most often used by therapists. So it is a good one for managing anxiety. And there's a lot of books on CBT and workbooks and what they call thought records, which are things you can find online where you kind of a worksheet where you write the trigger, what happened, what's the trigger, what's the thought that went through my mind, what proof do I have that it's true, that it's not true, what am I going to say to myself instead? And so by learning books and exploring some of those techniques or working with a CBT counselor, that's a technique that you can use to help with managing fear of recurrence. Another one is mindfulness practice and meditation, yoga. So a lot of those practices that are focused on bringing yourself back in your body. And some of you may be very familiar with the concept of mindfulness. Some of you may be less familiar. The easy explanation for those of you who may not be familiar is it's the ability to be in the present moment, which we very rarely are. We're often thinking about things that happen, or we're often thinking about and worrying about the future. But the past is scary and can be hard to think about, and the future is uncertain, and that doesn't feel safe. But right here in this moment, right now, there isn't anything that's happening that you're having a thought about. So if you're thinking, maybe my cancer's back, you don't know that. So right now, the moment is safe. Right now, the cancer's not back. So how do you kind of bring yourself back to this moment? And so that's a lot through meditation or yoga practice or different practices like that. People that practice meditation, again, as a long-term practice, if they do it over time, usually have more awareness of what's happening in their head, because sometimes we may not be aware of the anxiety that's happening in our head. But when we practice meditation regularly, we start to notice all these thoughts that go through our head, all these scary thoughts or unkind thoughts towards ourselves. So when you're aware of something, you can change it. You can be more likely to change it. So by practicing meditation, then you can start to make more conscious choices. I'm having this thought. You'll notice I'm having a lot of thoughts about recurrence. Now that I'm sitting still and I'm tuning into myself, I notice a lot of thoughts about this coming up. So then you can start to make a choice of, what do I want to do? How do I want to respond to this? And it might be grounding yourself by coming back to your breathing and meditating and coming back to right now. Right now is safe. I don't know. That's the future. But people have found success with mindfulness and meditation practices, and it's used in a lot of fear of cancer recurrence interventions and clinical interventions and support groups for fear of recurrence. It's one of the practices that's often used. The other thing is creating some distance between you and your thoughts. And this is called cognitive diffusion technique. So big word, cognitive diffusion. It comes from a type of therapy called acceptance and commitment therapy. And this is where you don't give much power to your thoughts. So when you have a thought like, my cancer, I'm just going to go with that example, my cancer is definitely back, you start to take some distance from it. So when you think, my cancer is definitely back, that's really strong. That's really powerful. And the thing is, your mind doesn't know the difference often between a thought and a fact. So that's why you might start to experience your palms might be sweating, your heart might be beating faster, you might be feeling a sense of anxiety and panic because you think it's true. Your body thinks it's true, your mind thinks it's true. So if you have that thought and you change it, so you say, I notice I'm having a thought that my cancer is definitely back. You see the difference. You're taking some distance. You're not saying my cancer is definitely back. You're saying, wait a second. No, I notice that I'm having a thought that my cancer is definitely back. It's a thought. And you create a little bit of distance, like you're an observer watching this. Or you say something like, there it is again. There's the story I'm telling myself that the cancer is back. Do you recognize this is the narrative? This is the story in my head. Or you ask yourself some more questions. Is this thought helping me or harming me? Is this thought getting me closer to the life I want to live and to my goals? And trying to take some distance from it in that way and to look at it in a different way. There's other positive psychology techniques. So we've talked about some of this already. You guys have brought up some great ideas about the gratitude practice. For those of you who may not be familiar as much with that, there's a lot of different ways to practice that. You can find lots of good information online these days. And a lot of that, it may be, what are 3 good things that happened today? So at the end of every day, someone might try to find 3 good things, that they did. It can take different forms. Some people might write in a gratitude journal. The 5-minute journal, for example, is one that I have friends that use, and they find that very helpful. They may use a gratitude jar. Or they might do something different. So for example, I have a 6-year-old son, and with him every night at dinner, we talk about what was our gem of the day, because my son's really into crystals and gems and all those things. So we talk about what was the gem of the day? What was the good thing about today? Or what's something that you're grateful for? So there's different ways to do a gratitude practice, but it's about long-term practice. If you do it regularly, over time, people become more optimistic and can see the good more easily. The other thing is savoring the positive moments. When you have those moments that you're outside and it's a really good day and there's not bad things that are happening, like really taking time to feel that and to feel what that's like, and maybe remind yourself of those moments. When you're having fear of recurrence and you're feeling anxiety, where's your safe place? Maybe you have a place that you've been to. Maybe it was on a trip somewhere and you can't really go there right now, but maybe you can bring yourself back to that safe place in your mind. Or maybe it is a physical place you can go to. Maybe it's the park near your house, or it's walking through the woods, or maybe it's your living room, having a glass of wine and being with your partner. What's your safety? Where's your safety and your comfort? Other people might use affirmations. I had a client who would often say, I can and I will, like for beating cancer. Or I've had clients who've used quotes that were really powerful, that helped them feel like either that they had control over their lives, or they felt like no matter what, like I'm strong and resilient, like a quote about resiliency and being strong. Inspirational stories. So, it's good to look at, success stories from people, who've gone through a similar cancer or things like that. If that's what helps you, you might need to look at good stories during your tough moments, right? To remind you that, it's not necessarily what my head's telling me it's going to be. And acts of kindness. So doing things for other people has been proven to help us. So volunteering or doing things for your neighbors, or, all those small acts of kindness help us to deal with stress. Other things are identifying your values. Who do you want to be? How do you want to live? And focusing on what contributes to that, and looking at what pulls you away from that. So asking yourself questions like, when I jump on the train and go to this place of anxiety and I engage with it, right? When I really give a lot of power to my thoughts and I'm not aware and I'm jumping on that train, is that helping me to really be who I want to be? Or is it occupying so much of my time that I'm not then being who I want to be? And what can I do to get off the train? And so just asking yourself good questions. Don't worry alone. Peer support, there's so much value in shared experience, and I know you guys know that from participating in these yak conferences, and yak programs, but there's really a lot of power in talking to other people, not only to feel validated in your experience, but also to learn what did other people do, what helped them. And there's so many tips and tricks that you can get from just talking to other people. um, Manage your overall stress, have good self-care, tune into how you're feeling, allow yourself to cry, allow yourself to process it and feel it, and find ways that you can express yourself. Some people, it may be through art, through journaling. Sometimes that's kind of your way to express the anxiety and to take care of yourself. Plan to follow up, so go to your regular medical appointments, communicate with your medical team about your concerns. And sometimes that can mean telling, let's say you don't know, what are the chances of the cancer coming back, and let's say you have this idea in your mind that it's a certain, maybe you think it's 50% chance it's going to come back. I'm just throwing a number out there, not sure. But maybe you meet your doctor and your doctor says, actually, with this cancer, there's a 10% chance or there's a 5% chance. That changes the story in your head, right? And that can help you. So sometimes asking a few more questions to your doctor may be helpful. Having a healthy, balanced lifestyle, exercise, nutrition, focusing on the things you can control to prevent recurrence, and keeping yourself well. When people are, kind of, there's something we often call in a lot of our programs, we say focus on the seeds, and that's like sleep, exercise, it's all the hydration. When you're stressed and you're anxious, often those are the first things to go out the window. We don't sleep well, we stop eating well, we're not exercising, but those things are things that can help you feel better. So they're good things to have in place. Finding your source of strength, connecting with your culture, your faith. So one thing I really love about coaching is my role, when I give these workshops, I throw out ideas and stuff, but really when I'm working with clients individually, it's really a lot of asking questions on what do you think you can do? What helps you? What gives you strength? I ask people questions and they come up with a lot of ideas. I had a client that just recently who, really, his faith was a real big source of strength for him. So praying was really something that helped him. Going to church, and connecting with what are those things that bring you back or that help you and that give you strength. Distraction has its place too and can be really helpful. So, it's often a bit of both. It's using distraction, because we can't be thinking about these things all the time. Sometimes we need something to just take our mind off things. We all need a break from cancer. But sometimes it's also the strategies, like you're looking at your fear, you're challenging the thoughts. So it's having a bit of the distraction strategies, but also the ones where I'm going to face this and do a bit of both, right? And recognizing when you need more help. And there's nothing wrong with that. A lot of clients I work with will go and see a therapist or a counselor. And although that could be a really hard step for people, it's one that's really about you showing up for yourself. And, counselors and therapists can really help you, especially if it's somebody who has oncology experience. So one of the handouts that I made sure to share when I was sharing these slides, and I think it's going to be shared afterwards with you guys, is a list of our counseling affiliates. So this is a list we've put together of counselors and therapists who have oncology experience. So these are people who know what fear of recurrence is and have worked a lot with patients and people who've cancer, and who can help you around how do I live and cope with this. So, there's real talking about it can be helpful, and in that can really come a discovery process of what's right for you. Medication is also something that can help people. Sometimes, the anxiety is so bad that it is impacting your quality of life and it's stopping you from so many things that maybe taking a little bit of anti-anxiety medication can help. And looking at some other options. There are, supplements. If you work with a naturopath, there are supplements that can help ease anxiety naturally. There are also things like CBD oil, like medical marijuana, that can help with anxiety. So there's lots of options. So talk to your medical team, but there are things that can help. in addition to some of the strategies we talked about. This is just a visual representation of something that we call a menu of options. So in coaching, we often work with clients and we start with, what do you think you can do to manage your anxiety? And then if they're not sure and they're like, I have no idea. So then we jump with them, okay, let's take a look at some options together. And, you know, if I were to say all this to you verbally, like I did, that's a lot to process, as you could imagine, an appointment. So we use kind of these menu of options. So we give clients a handout like this, which you're all going to get as well after the program. Where we've kind of summarized a lot of these strategies in here. And what it is, it's basically a list of options. So it's not a to-do list of everything you should be doing to manage your fear of recurrence. It's a list of options. So you look at that and you think, okay, is there something that speaks to you here? Is there something that resonates with you that you think, oh, maybe I should do this, or maybe I should start here? It's about starting with one thing. So as you're looking at this, you might say, oh, practicing relaxation techniques. I don't really do that. Maybe that would help me. I feel very anxious a lot of the time. I'm in go, go, go mode. So maybe stopping and doing a little bit of breathing techniques or yoga, maybe some Tai Chi, Qigong, maybe doing some online programs or things on TV like that could be a good starting point. Maybe it's something else. So these are just some ideas for you. I'm going to play a video. So now we're going to kind of bring it back. We've talked about fear of recurrence. I'm going to bring it back, just share a couple more things about coaching. And then I'm just going to take the last 5 minutes to do one last exercise with you guys to help you kind of with moving forward on what you're going to do next to help yourself with your fear of recurrence. So I'm just going to stop sharing my slides for a moment, and I'm going to share the video.
I was 37 weeks pregnant with my second, and I found a lump above my collarbone, and I just happened to touch it, and it was as hard as a rock. They thought it was my thyroid. They sent me for an ultrasound, and very quickly it became apparent it wasn't my thyroid. And it was that afternoon that I got a call from my obstetrician, and he got off the phone, and I just like screamed, I have cancer. And it was extremely traumatic, I would say. I don't even think I recognized how traumatic it was because I was just so overwhelmed. I had a 2-year-old at the time, and I was having a baby, and you're just supposed to be in that mode, prepping for, you know, a new life to come into the world. And then I was given this crazy diagnosis, bringing this new life into the world, and I was so afraid that I wouldn't even be there to know him. So I had Ethan, his name. So basically I went from having him, and then within 12 hours, I had a CAT scan, and then they were scheduling me for my surgery. So that was an extremely emotional time. I was like trying so hard to make it normal, but then it wasn't normal. And that was very, very difficult. So I did about 6 months of chemo. After about, I think it was the first or second treatment, already I could no longer feel the lump that I had initially found. So that gave me a lot of hope because I felt like, okay, it's working. It's obviously working if that's shrinking. I had a PET scan in May. And so then in early June, I was told that I was in remission, and that was a great day. It was actually the first time that I hadn't cried in a doctor's office up until that point. And then he told me, and I burst into tears. It was like, it was finally a release of all of those emotions. That period was also one of the worst periods. I was terrified. I was terrified of my body because I felt like I wasn't on the same page as it. I didn't know what was happening inside of it. So I started to deal with a ton of anxiety. And then that anxiety, because it got so bad, sent me into depression. The physical part only took 6 months, but the emotional part, it took years. Cancer coaching and somebody who can understand what you're going through and help you find those supports, I think is a wonderful thing to be able to offer people who are going through this. And I feel like my doctors fixed me physically, and then this group of people helped fix me like emotionally, because cancer is a very lonely experience. It's not just physical. The physical is very important because it keeps us alive, but the emotional, the mental part of it is also huge.
Right. So it is, our service mostly is for people in Eastern Ontario and Western Quebec, but you know, if somebody reaches out for coaching and they sign up on our website, we are here for you. So yeah, they can take a look. So that's a good segue actually for me to just come back to the slides and just talk about Yeah, what we offer again, individual cancer coaching is available to you. It's offered by telephone and secure video chat. So it's social workers and nurses by background. We focus on how cancer impacts your life, and we help you work on the goals that matter to you. So managing stress and anxiety, coping with side effects, making decisions about the future, such as going back to work or figuring out what your priorities are now, and coping with emotions and anxiety remains the top reason people reach out to the Ottawa Regional Cancer Foundation for cancer coaching. So if you're interested in working with a coach, visit our website. It's ottawacancer.ca. In the top right-hand corner of the website, you'll see a little button that says register for cancer coaching. So if you click that, you can sign up and find out more. You're able to actually book online appointments with a cancer coach. So basically, you fill out the questions, and then it brings you to a page and you get to pick your cancer coach. So you read our biographies, see our pictures, see who you think would be the best match for you. And you're able to book your appointment right then and there. A couple other advantages is, following our appointments, you always get a copy of your coaching notes. So exactly, you've got a summary of what we talked about, what you kind of came up with as a plan. We write up all that for you. You have access to our health resource library, so you can find more information there on fear of recurrence. You can also instant message with your coach. We have tracking tools where you can track things like physical activity or your mood or different things. So we use a really interesting platform that gives you access to so much other resources. So there's other programs and supports available besides us. Young Adult Cancer Canada, of course, has a wide variety of programs. I was recently part of the Depression and Anxiety Community of Practice group, and Kahin, who some of you may know from Young Adult Cancer Canada, was presenting some of the innovative, new programs that YAC has come out with since the pandemic. And there's so many awesome programs that are available. Cancer Chat Canada also has online support groups, so they're also a group worth looking into. They actually do run a group maybe a couple times a year focused on fear of cancer recurrence. So if you're looking for something specific on that topic, they're a good one to check out. Mindfulness-based stress reduction programs. So these are programs that are based on teaching people mindfulness strategies. Usually they're kind of 8-week programs. There's places like the Ottawa Mindfulness Clinic that offers them. And various different places. I know like the University of Ottawa I've seen has offered them. So those are programs, if you're interested in learning more about meditation, that can be helpful. There's also some fear of cancer recurrence studies that are offered from time to time through the Ottawa Hospital. Dr. Sophie Lebel is a psychologist in Ottawa who does a lot of those groups. So if ever you're interested, it's worth asking the Cancer Centre if there's any studies happening right now on fear of recurrence, or looking up information online on maybe Dr. Lebel and seeing if there's any of those groups happening. And the list of counseling affiliates, of course, that you guys will be receiving is another resource. So I'm going to open it up. We have 5 minutes left, or 7 minutes, and I'm just going to open it up for 2 things. First off, I invite you to take a moment. So if you take just 1 minute, grab your pen and paper again, and I invite you to reflect on what's one thing that you commit to doing in the next couple weeks to help yourself around fear of recurrence and living with anxiety. So you've heard a lot today, everybody jumped in. You guys had so many wonderful ideas to share. What was your takeaway? What was like one thing that you're going to do for yourself? And maybe it's something you're already doing, but maybe you're going to do more of it, right? More often. Or maybe there's something else you took from today that you really want to try. So I invite you to just think about what's your commitment towards yourself for what you'll do. And I'm just gonna give everybody a minute to do that. And then I invite you guys to unmute yourself or write in the chat box. I'd love to hear some of the things you're gonna commit to doing for yourself. And I open it up to questions, of course. So let's take a minute to do that. And then I open it up to anyone to share. So we've had about a minute. So anybody that wants to jump in, you can unmute yourself and share what's your commitment to yourself. What will you do? You can write in the chat box, and I welcome any questions, of course, as well.
We're lots of good ones in the chats there too. Lots of mindfulness practice, diet, exercise. Great work.
Good. Great idea.
Melina, thank you so much for your awesome presentation. Your slides so laid out, your energy, the expertise, and the work that you're doing every day. We're so grateful that you brought it here for us today. I know a lot of us are checking out Ottawa Cancer Foundation, and there's a lot of interest to explore the mindfulness piece. Something that we talk about regularly in the ACT community, and you've helped reinforce that message again today. So it's really, really important, and thank you for that.
Perfect. And it's my pleasure. And yeah, I invite anybody, after the presentation, if you'd like to get in touch with me, feel free. I'm always happy to talk to people, one-on-one if you just have questions and want to chat some more. All of our coaches, by the way, are trained in mindfulness-based stress reduction. We actually got a training a couple years ago because we had so many clients that were interested in learning mindfulness and practicing it that we got trained. And it was interesting because the training was geared to how we could learn how to teach and help people set goals to learn mindfulness. So we can also help with that if there's anybody who's seeking some more kind of guidance and coaching around how to practice and learn mindfulness. So yeah.
Love it. Yeah, and tons of thank yous. Thank you, thank you, thank you, thank you. Fantastic. Thank you in the chat. So lots of gratitude floating around for you. And Melina, thanks so much. And I can't wait till we connect again.
Oh, me too, Jeff. And thank you everyone for spending this time with me today. Have a great day. Thank you. And enjoy the rest of the conference.